Test results rarely catch medical professionals off guard. They're used to analyzing data and planning a course of action until the results they're studying are their own.
Anytime you hear the word cancer, it's scary. I mean, if you're an athlete and you hear ACL, that's scary. But if you're just a normal person and somebody tells you now you have cancer, no matter what kind of cancer it is, it's scary. That's a scary word to hear.
A prostate cancer diagnosis in 2017 wasn't easy to hear for Mariners' longtime head trainer, Rick Griffin. But it also wasn't out of the blue.
The last 2 years, my numbers got close to where they kind of say, oh, you need to get some additional testing.
He monitored his numbers by getting tested every 6 months instead of every year. When his numbers dropped during one of those tests, he was relieved.
All those other times, because I used to think, oh, it's because I ride a stationary bike a lot or I run a lot or whatever. I'm trying to think my way out of the fact that the number's going up. And then I went to spring training, and then the number was higher than it had ever been. And then that's when I went, oh, this isn't good.
The official diagnosis came during a Mariners road trip, sitting on a bench by himself before a game in Anaheim. Calling home to tell his wife Rachel was difficult because she herself was undergoing treatments for breast cancer. The newlyweds would lean on each other like never before.
I just tried to stay positive, and Rachel helped me with that. We went back and forth, being each other's little positive life coach.
Griffin underwent surgery in 2017 to remove his prostate. A reoccurrence of the disease in 2019 led to proton therapy earlier this year.
I chose the proton therapy versus conventional radiation therapy because the proton therapy has considerably less side effects. And in my case, I am so lucky because I had zero side effects. I even joked to the doctor after about 2 weeks, are you really doing anything to me? Because I feel completely normal.
For the most part, life is back to normal for Griffin and his wife. Pandemic aside, both have been given clean bills of health and are back to enjoying the outdoors. That's something that wouldn't have been possible without early detection and treatment.
The best way to treat prostate cancer is to detect it early because you have so many different options to take care of it and to treat it. And prostate cancer is unusual in that there are no signs. Like if you never had a PSA test, you would never know you had it until the symptoms became so bad, and then it would be too late.
He advises men to take charge of their own situations by getting regular screening starting at age 50. If you have a family history of cancer, start at age 40. And find a doctor you can trust.
If you truly trust the person that is doing your medical care, you're going to have a really good result because you're going to give them the trust in your mind, and they're doing the very best thing to take care of you as an individual and take care of your cancer.
For now, Griffin and his wife trust the health challenges are behind them so they can look ahead to normal and cancer-free life ahead.